after the late lunch. We're all very busy, so we'll start now. I would like, first of all, maybe for everybody to remind us who they are, just to make sure that we understand a little bit better for people who've not been here for some time. First of all, I would like to welcome Professor Shantini Parajotti as a new Director of Public Health, and I'm seeking the board approval for Shantini to be the new Vice Chair. She would replace, of course, Susan Webb, who was the previous Director of Public Health. Can I have an agreement on this, first of all? Very good. So welcome, Shantini. And maybe start with you, Shantini, to present yourself, and then we'll go around the room, and then we'll go online.
Thank you. So Shantini Parajothi, Director of Public Health.
Thank you. My name is Nicole Davey. I'm an Improvement Program Officer with Community Planning Aberdeen. Councillor Kate Blake.
I'm Councillor Christian Rath, in case you can say, and now we've got a new area.
Surrender Adley.
You saying yes? Because
These microphones will be the death of me.
it's on. It's on.
Okay. Hussein Patwa, the current chair of the Integration Joint Board for Aberdeen City. Thank you for having me.
Donna Hutchison, Aberdeen Cyrenians.
Hi, Gogo Kafo, Aberdeen City Council.
Martin Gregg, I'm a member of Aberdeen City Council.
Alison Swanson, Community Planning and Improvement Manager.
Okay, and if we don't mind, can we go online, please? I see Phil, first of all.
Phil Mackey, consultant in public health and prevention lead for the City Health and Social Care Partnership.
Thank you, Phil. Matthew?
Hi everyone, thanks Chair. Matt Lockley, Head of Regional Opportunities at Scottish Enterprise.
Margaret, please.
Hello, I'm Margaret Stewart. I'm the Service Manager for Libraries and Community Learning, Aberdeen City Council.
Thank you, Margaret. Andrew?
Good afternoon, everybody. I'm Andrew Wright. I'm the local senior officer for the Scottish Fire and Rescue Service for Aberdeen City, Aberdeenshire and Moray.
Thank you. Jason?
Good afternoon, everyone. Kate Stevens sends her apologies. You've got me in her stead, Jason Kerrigan, Superintendent for Partnership and Events in North East Division.
Thank you. I can see in the chat that Susan is traveling, so I might not disturb Susan Helston, who is from this school, of course. So shall we start the meeting? So for the one who were not there, we have approved as the Vice Chair. Maybe the Vice Chair wants to say a few words.
My microphone's been on. Thank you for the welcome. I've been a couple of times to Community Planning Aberdeen before, really looking forward to working with you all. And I think we've taken a different kind of tack to the agenda today. So really looking forward to the discussion. And I think I'll leave it there for now. Thank you.
And indeed, Shantini had already a lot of improvement into our agenda, which is fantastic. First, the draft minute of the meeting of the 18th of June 2025. There were a couple of actions. I noted that they are completed. Are we happy to approve the minutes? Thank you very much. And then we've got the draft minute of the Community Planning Aberdeen Management Group meeting of the 13th of August. Again, it's for information. Any question, anything? No? Happy with that? And then we got the forward business planner, that's page 17 to page 18. So the current plan business and 200 will be populated further after today's agenda. Any question on this? No, I shall remember all our partners that we have done in the past. I think Andrew was very good to invite us in the premises, Andrew Wright. So I think if any other partners wants to host one of the meeting, be delighted to do that if it's possible. So you've got no question on the forward business planner. we go straight to 4, which is the Scottish Location Director update, page 19 to 22, which is a small update from Richard McCallum, who's given his apologies, and the update is there for everybody to see. If you have any questions, you can ask them now, and we can take a note and send them back to Richard, or you can maybe send us an email for any questions that you have. I like to note that Richard has been very straightforward, saying that the public sector is asked to do more with less people and less funding, and trying to save 0.7 billion per year, which is going to be, I look at Chantilly for NHS and for the local authorities, going to be very difficult, and there's a big ask as well for population planning. We'll maybe speak about that later on. I don't know how we can plan so much for population ups and downs, which is not easy. Anyone wants to add anything to this? Chantilly?
So I think the final item we have on the agenda today speaks to the population health framework, and that's some of what was covered in Richard's paper. So I think we can take some of the discussion there. I think it really is about how needing to do more with less maybe means that we need to work together a little bit differently. So, how can we do that? And I think community planning gives us a good mechanism for doing that, but it's, how we make that happen really, I think.
And of course, on top of that, prevention is the main thing we've been asked to do. I saw a hand up, Councillor Blake.
Yes, thank you, convener. I was just interested in number 22 about the inactivity rate, which was pointing to Scotland having a higher inactivity rate in comparison to the rest of the UK, and some other countries don't, lower than the EU average. And I just wondered whether there was further information about that. Why? Do we have any idea why we have a higher inactivity rate? You probably can't answer that. You might have to take that away. So maybe somebody knows.
If nobody wants to take that on today, we might send that back to Richard and see if he can give us some details on that, if the board agree. Very good question. Any other question? Yes, Councillor Gregg.
It's kind of a general question. The report is relatively high level, and there's mention there of spending plan targets and so forth, and it would just be useful to get more of a sense of when will we have a better understanding locally of what are the plans, what are the pressures, what are the opportunities? Is that going to come through the Scottish Government spending review and the budget process? Just to get a sense of the timeline, because we have to prepare for the reform that's coming, and that will be necessary. And we want to be a positive, productive partner with the Scottish Government. So getting that information would therefore be, I think, quite useful.
Absolutely good point, and we can maybe put that to Richard. I think Richard had put something in his update of the challenging that the UK government has delayed the budget, which means that Scottish government will be delayed, and we are likely to be delayed as well. But it'd be good maybe to ask some clarification from Richard McCallum, if everybody agrees. Any other question online or no? Are we happy to move on? So we'll move on to the thematic session, emerging system changes. So for the one who've been at the conference, thank you very much for participating. I think you can give us some feedback about it if you want today. But today we're going to focus about something else for people who were not at the conference or people who were at the conference and want to put a little bit more input of what they have done already at the conference time. So I'm going to leave it to Alison to maybe give us a little idea.
Thanks, Chair. So as members will be aware, our outcome improvement groups have been using the evidence base that we took to our last Community Planning Board meeting to develop those emerging priorities and system changes for inclusion within the next Local Outcome Improvement Plan 2026 to 36. So some of those emerging priorities and system changes were presented at the Aberdeen conference that we had on the 27th of August. And you have the report of the output of that conference on your agenda today, with the feedback that we received both from the expert panelists, but also from participants in the workshop sessions. So our groups are using that feedback at present to further develop and refine their proposed system changes and priorities. And as part of that process, we have brought them here today for you as our board members to reflect on them from your perspectives in terms of what you're seeing from those emerging priorities and system changes. And we've put 3 discussion questions there on the agenda for you each today. So which of the systems changes are standing out for you? Are there any system changes that are missing from your perspective? And where might there be challenges that we need to overcome in taking forward some of those system changes? So as I said, the groups are still very much in the development process in terms of taking on board that feedback and doing that further refinement. So we don't have presentations from the chairs today, and our chairs are not present, but welcome the board's reflections and discussions, and we'll make sure that those are taken back to the groups for further consideration. So I'll pass to the chair.
Yeah, thank you very much, Alison. The idea to not take the chairs, it would have been a lot of people talking to us, and we want really, Shantinia is absolutely right, to try to be able to a lively debate around it and taking these notes and then fitting that. So I'm not going to take everybody one after another one. I'm going to ask people who already have thought about these discussion questions, who are ready to give us a little bit of input. You can, of course, send us an email later on with more of your input, but it'd be good to share that input with the board. So I'm happy to start with whoever wants to start. Shantine wants to start? Yeah, go ahead.
Happy to go first. Thank you. I was at the conference, and just to say, congratulations to the organisers, because it was a really well-run event and really well attended as well, and lots of input from Public Health Scotland, etc. And really lots of high-quality discussions, I think. So I'm just going to give my reflections on some of the system changes that stood out for me. And I'm going to start with the one on using multi-agency data to support targeting of interventions. And I think this is something that's quite key for us. And I suppose I was a little bit surprised to just see it in the children, families and lifelong learning section of it. And I think that's something that actually probably can or should be central across all the 5 the social determinants of health. So there's something about how we make the use of data and how data informs our actions, making that a bit more central as a systemic change. And the other side of it is to make sure we extend that use of data to support evaluation and tracking impact as well. And the second thing I was going to pick up on was wraparound support. So that's another thing that's mentioned in a couple of areas, but there's something about how do we make sure that some of these elements that appear in more than one area are connected to each other, so that we're not running the risk of groups doing slightly different things, but actually it's all joined up as one approach, because that would be the real system change. And then the next thing, the bit that I thought was missing, perhaps something around digital. So Richard's paper highlights the importance of digital as part of the service renewal framework. It's also part of the population health framework. But for me, what didn't come through so much was how we might be thinking about using digital approaches to reflect societal expectations and our system needs. And also, how are we using digital to think about delivering services that are accessible through digital technology. And then my final point is around neurodevelopmental pathways. Really welcome seeing that work there, and just, maybe highlighting the need to join up. I assume it's all joined up, but there's clearly work going on in the NHS as well around neurodevelopmental pathways, and I think that's an opportunity really to bring those things together. I'm sure they probably are, but maybe making that a bit more explicit might be helpful. Thank you.
Thank you very much, Shantini. We got all that. Anybody wants to follow up? I'm going to give a volunteers online, or Phil is thinking about it.
Yes, I am always thoughtful when it comes to areas such as this. I think the main comment I would make at this stage is that it is not so much what was discussed, it's the opportunity that it presents to us. I think there is a real power in the identified determinants to refocus the work that we have been doing, not just within the LIPE, but in a much broader range of areas across the city, particularly in moving towards more preventative approaches. So overall, as a general comment at this stage, this move is extremely welcome. And also, I think as Shantini has kind of really alluded to, it does require us to think again at the way in which some of the areas of work which we are undertaking do need to be reflected upon. So I'm going to pause there, because otherwise I could start a longer ramble, and I'm sure there are other people who might want to speak. But it's the opportunity presented that I keep coming back to when I look at the report in particular, and then reflect on the restructuring of the LIPE around the determinants.
Thank you very much for this, Phil. Yes, but a discussion question: which system changes stand out for you? Are there any system changes missing from your perspective, and where might there be challenges you may need to overcome? So as Phil said, you don't need to go on this three questions, but it'll be helpful if you could frame your answer around it if you can. Councillor Craig.
Thank you. Yeah, I think that in responding to the question, it's very much a case of continuing what we're doing, the partnerships, the work practices that we have, the joint working, but accelerating and deepening the relationships between the community planning partners. I think that will really help us to answer these questions more effectively. And there are a couple of standout issues in various of these themes. So, for example, from the children's and families, I think the advocate idea for vulnerable families. Right, we have a family support model in place that's working very well. We've got a fit like model and so forth. So we've got templates of how to work together to support families and individuals, but we need to build on that. So the advocate idea from the Best Start in Life section, also from the economic stability side, I think that there are examples of outreach, supporting people to find the right employment, the right type of training, and specialized courses and so forth that will help them to become, to find the right opportunities. And that again relates back to the children and families theme about creating bespoke support programs for young people so they have a positive destination. We've got ABZ Works and ABZ Campus. We're creating that tailored model to meet the needs of individual pupils. So more of that, and I think that means that we need to strengthen our solidarity as a community planning partnership. Thank you.
Thank you, Martin. Yes, replicating the template that we already have and adapting them in different way. I'll go online. Jason?
Thank you, Chair. There was a lot of things in here that drew my attention. I'll limit it to 3 or 4 that I'll make comment on. The community assistance hubs for me was one of the standout ones when I consider the integration of service delivery within our communities, because that for us in the operating model review that we'll come into next year is going to be key in terms of the integration, how we actually come together and coalesce in a community to deliver those services. The introduction of lived experience in there as well. We do it to a point, but actually fully embedding that into our decision making and discussions around how we tailor service provision is really, really interesting. Something that I'm very much for, and that links into the community contracts piece as well. So how do we actually manifest that within our communities, because they're all really, really interesting concepts that have been explored before, but actually bringing them to fruition is quite difficult. Just touching on Shantini's point there as well. So I'd be really interested to hear from Martin Murchie in the coming sort of days, weeks, just in terms of how his visit to the Edinburgh Futures Institute went, because I'm there in 2 or 3 weeks' time, and I'm really keen that our data comes together to form a really integrated data piece right across the service, right across the community planning partners, to understand really in depth and on a multifaceted way what our communities look like and what services they need and what services we should be prioritizing. My one fear is that there is a lot of stuff across all of these themes, and again, blue sky thinking and really aspirational, but it's set within a financial landscape of doing more for less. So that is the only bit that sort of worries me a little bit. But again, the integration piece, if that's pushed, then hopefully we should be able to achieve that. So again, like Phil, I could talk for days on this stuff, but I'll limit it to that.
Thank you very much, Jason. And we would love to hear from Martin Murchie and from yourself about your visit to Edinburgh. I'm sure that will be a lot interesting. Councillor Blake.
Thank you, convener. Yeah, there was one of the things I wanted to mention. So obviously I was at the event on the day, and actually echoing what Jason just said, that actually did come through in the afternoon when you were talking to people in the groups, that people were really bought into trying to look at the different items, but people were also a bit skeptical about how, within the constraints that we have, that you could deliver some of these things, or so you could sense there was definitely coming through in the conversations you were having that level of skepticism, alongside people being quite interested in what was being proposed, and people were obviously making comments and making suggestions. And actually also subsequent to this, we had a conversation at Community Council the other week, and last week Kev brought it to the Community Council, and actually one of the things that they said was about language, and about making sure the language was the clarity of language that we use, and speaking in plain English, which I know is something you very much agree on, Councillor Allen, because they were basically saying, actually, I don't understand that. I don't understand that. That really makes no sense to me. It needs to be explained in a much clearer form. So I think as we consult more broadly about this, then we really need to think about how we're saying, how we get that across, and we don't put it into speak that people generally don't understand. But it was a really useful day, and I would say, I would again echo the congratulations to the team who organised it. I personally find it very useful. Thank you.
Yeah, thank you very much. I think the teams really enjoyed it, and I think the actual panel were very nice and complimentary to Aberdeen. We shouldn't take that as granted, but we need Angela Scott who's next.
Thank you, Councillor Allard. Just to maybe pick up on Councillor Blake's point, we've been having that discussion around what's a version of all of this for professionals that's got underpinned by theories of change and data, versus what's a version for the public. And we're well cited on the talent of colleagues in Aberdeen Art Gallery have a very creative way of curating stories, and I guess this is the story of Aberdeen, isn't it, that we're telling. So we're going to explore how we can use the talent of colleagues there to have what's a version for us and as kind of set of professionals versus a public facing version. So I just shared that to give you comfort. To your own point and Jason's about resources, again, that was my own reflection, that we're all very busy and constrained. So just been chatting to the team around, I think we've got to keep running back through these propositions to test whether they do stack up in terms of the impact that they'll have, and therefore are we willing to step back from some other things in order to provide the capacity. I do think, again, as a partnership, we've got to start to think more about how we present our picture of the resources that we're committing to. Certainly from an Audit Scotland perspective, there's a real nudge about statements of joint resources and what partnerships are committing to, not dissimilar to what we do through the health and social care, where there's a very clear statement of the joint resource that's coming. So I think at senior level, we're going to have to work through what that statement of resources looks like, with an agreement from chief execs that these are the things that we think are absolutely worth our whole system kind of committing to. So we're going to just look, Councillor Blake, about doing a wee bit more scrutiny around that and think about how we can present it. To Jason's point on data, so I was at the Edinburgh Future Institute. They are looking to develop a common data platform using a lot of data that I know Shantini and colleagues are plugged into. So Martin, on behalf of Aberdeen, has made the connection to ensure that development, that we're not out of sync with that. In fact, I think the sense from EFI is that some of the work we're doing locally here is perhaps ahead of the curve, and actually EFI might want to piggy on the back of us. So absolutely, we'll share that. To the point Councillor Allard about what's missing, again at the EFI conference last week, there's quite a bit of attention put on social impact bonds. So where you're using and bringing in philanthropic contribution, and you're connecting that as a contribution to get capacity to support a preventative outcome. I think in the context of resources, that's something that we might want to explore a wee bit further. So I've got a call with a national colleague to explore that. But that's an area that possibly is missing just now, that I think we can look at how we can get some more capacity for delivering the ambition. And I guess the only thing, and not to play to the gallery of Donna being here with Cyrenians, but I guess what you see is a third sector partner who is completely aligning to the LOIP. So really interested around how can we ensure and support that even further, and what more change do we need to make collectively to our commissioning approaches and so on in order to kind of support that. But social impact bond is just probably an area I'm curious to explore and see what that can do. That would be my missing bit in terms of where we're at the moment, and the resources. I think the management group on behalf of CPP needs to get underneath the skin of that a bit more, and what we want that to look and feel like too. Thank you.
Thank you very much, Angela. We've got Andrew online next.
Thank you, Chair. My point's around the health and social care and the improving health and life expectancy. When it says partners contributing to addressing the root causes of poor health and promoting well-being, ultimately reducing future healthcare costs, it's like, how do we prioritise that so we ensure we are actually addressing the correct issues and balancing ambition with realistic goals? And also then, how do we measure it, and how do we measure success in that area? Because that's long term. A lot of those strategies, we're not going to see the benefits for 10, 15, 20 years, but we have to ensure that we are still targeting it correctly to ensure that we're getting best value for all the services that we're putting into it. So that one's quite hard for me to quantify as how we move forward with that one. Other ones that I'm very, very interested in is the Fair Work and Employment for All, and developing a localised employability accreditation, recognising life skills to support people to start new jobs. and then empowering children and families, again, creating bespoke support programs for young people who are likely to disengage from schools. Myself and our police partners already do quite a lot of work on that, and I feel that those two could link up in some way. So the disengaged youth that we are engaging with could hopefully then get some form of employability accreditation, recognising their life skills and other attributes that they would bring to employment that's not necessarily an academic qualification. So I'd be very, very keen to progress that and be involved in those conversations, because I think that's something we could do.
Absolutely. Thank you very much, Andrew. And yes, employment for all, knowing that some people will, for whatever reason, never manage to hold an employment, but making sure that the opportunity is there for everybody to try is very important. And that answer may be one of the questions that Councillor Blake, and we'll see what the Scottish Government is going to come back with. You know, we have to understand that Scotland and maybe what's the figures showing about people not in employment. We've got a very aging population, so that will be another explanation. But I absolutely agree with you, Andrew. And we look at Martin Mitchell, we look at Phil, we look at everybody can help us on that. Is how to demonstrate that prevention have got the best outcome possible when it's the most difficult one to measure. and we can all realize this. Who wants to go next online? Oh, listen, Patois, yeah, listen.
Thank you, Chair. I've been listening with great interest to this discussions. I thought I would chip in a few points. It won't surprise you to know that I come from a health and social care perspective. So just got a few things to throw into the pot, I guess. I was very interested in the concept around inclusion ambassadors. Be interesting to see a bit more detail about how that would work. And I think there is always merit in having community champions for things and trying to influence people. But I also wonder about using existing community assets where particularly elderly people who already suffer statistically greater loneliness and isolation, folk that people will come into contact with as part and parcel of life. You know, they need healthcare, they do shopping, they pay bills, they do all of these things that are a part and parcel of what we do. Are there ways that we can use the connections that they already have to do something around promoting inclusion, reducing isolation, building those additional connections, particularly when you take that alongside the prevalence of digital exclusion that we already have? So I guess playing to our strengths and using the assets that we already have in the community. I was interested to read the section on healthy weight, and I'm very pleased with the change of language that has come about in this area over the last few years, where we no longer focus on one side or the other. I can't help thinking, though, that there is always an inference when you look at the detail of these things in favor of trying to do work around those who are overweight unhealthily. It's probably worth remembering that we have an equal problem with people who are underweight, particularly for those who are experiencing long-term conditions. And that gets us onto some of the challenges. There are still some structural challenges within our health system around people trying to get support for that. For example, one that I've run across very recently, just by way of example, GPs cannot automatically now prescribe certain things, even when it's common sense to do so, and clinically that is the right thing to do, without needing a referral to a separate practitioner. And that obviously builds delay into the system. And if people don't want to experience that delay, potentially they then go and try and self-provide. And that brings us into the area of affordability. And are we then exacerbating barriers through something that is structurally built into the system that could make that entire process easier? And lastly, I was taken by the point on health and safety at work. And I wondered if there was scope to build in something around culture. And I'll speak to long-term conditions as well, just because it's something I'm very familiar with. Statistically, we still have an underrepresentation of people with long-term conditions in the workplace, and particularly so at senior leadership level. And you have to ask yourself, you know, some of that will be due to the condition itself. You know, there will be some people who will always be be excluded because of what they have to deal with. Some of that will be around there's not enough access to support, the financial resource that's needed to support them in that. But some of it will also be due to organizational culture and changing work practices, making them more inclusive and equitable so that we cater to people's needs in a way which gives them the best opportunity, but also allows the organization to continue with business as usual. So I think it would be useful to see some thought and maybe some development around workplace culture. Thank you, Chair.
Thank you very much, Hussein. Very thoughtful indeed. Anybody wants to go next before I nominate? Donna wants to give us experience maybe of the conference itself.
Thank you, Chair. Yeah, it was a great day, and I kind of passed my appreciation on back to the community planning team because I know these things aren't easy to pull together. I think the format was excellent, and it was good to see the mix. And I think it would really echo some of the comments that have already been made. I think for me, it's about how those ideas that cross over the different 5 areas now come together, because there's some overlap and duplication, which you'd expect at this stage. So I think I would just be echoing the comments that we've heard earlier on the next stages to go forward.
Thank you very much, Donna. Indeed, we are now in that next stage. Matt wants maybe to add something regarding employment, or how Scottish Enterprise can help us through this.
Yeah, thank you, Christian. I was just reflecting on the economic stability section in particular, and I think my challenge back, I suppose, is whether we've got the balance right in terms of the supply side issues versus the kind of demand side. And by that, I suppose I mean there's a heavy focus, obviously, given the nature of the LOIP and the community planning partners' ambitions, there's a heavy focus on the people aspect of this, but less so on the kind of the growth and job creation side. So I think maybe there could be a bit more in here around what community planning partners and what the likes of Scottish Enterprise could and should be doing to create the conditions for growth and create those jobs that then are supported by the supply side initiatives that are outlined here. So I think maybe I can feed back offline in terms of maybe some thoughts on that, but I think that aspect of job creation and linking through to the regional economic strategy and things like the investment zone, which is a 10-year investment plan for the region, how we embed that into here so that we're training and supporting people into those future opportunities. I think that's my reflection, particularly on that economic stability section.
Brilliant. Thank you very much for your input, Matt. Absolutely. And job for all again. Hussein puts the finger on it. Older people, we don't want our elderly to go back into work. So we need to understand very much different ages, our population, our aging population. How do we respond to this? Anybody? Yes, Angela wants to come back.
Thank you, Councillor Allard. Matt, just to your point, just thinking about the incoming community wealth building bill and the requirement on all partners around community wealth building action plans and so on. I wonder if we started to look at that and really grabbing hold of that in terms of particularly opportunities around our procurement and so on. Is that what you were thinking? Because I guess we need to be clear about the distinct contribution of the CPP and not duplicating the regional economic strategy. Is that the area that you had in mind, Matt?
I think so. I think it's thinking about how we can corral all of that, Angela, into something that has a kind of clearer focus on that job creation aspect, so that we're sure that we're training young people in particular, but other communities for the jobs of the future, and that we've got that line of sight to both what we're procuring, but also what the job opportunities are and which sectors of the economy are likely to grow. So I think it's a bit of a blend of community wealth building and also an eye on the future direction of travel with the regional strategy and so on.
Okay, thank you, everyone. Anybody wants to have a last word? I think Alison took a lot of notes. And as I said, don't hesitate to put it in writing. Phil, what's the last word?
Well, actually, Councillor, it's your last word. In the report, you did make quite a considerable point around ensuring that the work that we're starting here is able to be responsive enough to deal with the climate crisis, particularly in creating resilient systems and services. I think there is a good habit that we can be developing now, or should develop now, to make sure that we are sense checking the work we're doing over the full 10 years of the LOIP, and in creating fairer futures which do achieve the just transition that we are also under an obligation to deliver. That's something that I think is a real challenge in the preventative world, because we deal with a future state as well as a current state. And I think that's something that we are going to have to learn to live with in a much more effective way.
A sharp reminder. Thank you very much for this, Phil. Everybody happy? And as I said, you can always contribute. Alison, I'm sure, will take any other thing and bring them back to the chairs. So if everybody has shared the reflection, will be shared with the outcome improvement groups, and that will continue the development of the local outcome improvement plan 2026 to 2036. We'll go in 3.1, and this is Donna, Aberdeen Cyllenian 2025-2030 strategic plan. So that was page 23 to 60. And of course, thank you very much, Donna, for bringing. Unfortunately, online, you don't have one of these, so you are missing out. Donna wants to say a few words about it, and maybe if people want to have any question.
Thank you, Chair. So good afternoon, everybody. Thank you for the opportunity to speak with you today. So as many of you know, Aberdeen Cyllenians has been part of the fabric of this city for over 50 years. We were founded on the principle no one should be left to face crisis alone, and that principle continues to guide us today. Our new strategic plan for 2025 to 2030 is not just a roadmap for our organisation, it's a call to collective action. It reflects the reality of the challenges we face in Aberdeen on homelessness, poor mental health, substance use, poverty and social isolation, and that they are deeply interconnected. And they are not just the results of individual circumstances, but of the social determinants of health. And we know that term can sound technical, but it's quite simple. Our health and well-being are shaped by the conditions we live, our housing, income, education, employment, and access to care. And when these foundations are unstable, people are more likely to experience crisis and less likely to recover without support. This plan sets out how Aberdeen Cyllenians will respond with compassion, yes, but also with strategy, partnership, and purpose. It aligns closely with the ambitions of the Community Planning Board to reduce inequality, improve well-being, and build a fairer and healthier city. Over the next 5 years, we will focus on prevention and early intervention, integrated support across housing, health, social care, and employability, empowerment and inclusion through co-producing services with people who have lived experience, collaboration and system change using data and insight to influence policy, and build the foundations for sustainable social change, ensuring our organisation is resilient and future ready. In the plan, or the paper copy of the plan, you'll read stories in the plan of William, Lily, Mary, Beth and Paul. Each one is a reminder that change is possible, that with the right support at the right time, people can rebuild their lives. And behind every one of those stories is a team, our team of staff and volunteers showing up with compassion, skill and humanity, whether it's making a cup of tea, helping someone navigate a housing forum, or simply listening without judgment. These moments matter. They are the quiet, powerful acts that change lives. This plan has been shaped by the voices of those we support, our staff and volunteers, and many of you around this table. It is grounded in evidence, aligned with local and national priorities, and driven by a shared belief that everyone in Aberdeen deserves the opportunity to thrive and prosper, regardless of background and circumstance. I look forward to answering any questions you may have today and continuing to work together to make this vision a reality. Thank you.
Thank you very much, Donna. And I'm looking through it, and I can see some journey of change, and it's powerful. I think we've done that in our report as well, just to make sure we give people a voice of what do we think about the services we are providing to them. Any question for Donna? No, thanks very much, Donna. And as I said, all the partners are always very welcome to bring to our attention what we are doing. And we all have the details of Donna, so we'll be delighted to further any question. You can go straight to Donna and ask her any question that you might have. Alison, you want maybe to give a reminder to the board member regarding our approach?
Yeah, I just wanted to, through you, Chair, to thank Donna for bringing the Aberdeen Iranian Strategic Plan to the board meeting today, and a reminder to all of our partners in terms of back in February when we had the review of our approach to improving outcomes paper, it was agreed that all partners would take their strategic plans through the board so that you're reflecting in terms of the alignment to the local outcome improvement plan. So just a reminder, if we haven't got those on our forward schedule yet, if we could get those planned in over the forthcoming year.
That would be great. And as I said, you can even bring them to this board, and we'll be delighted to discuss them and having you presenting them. Are we all happy with this? Yes. We'll go to the next one, which is Community Learning and Development Plan 2025 to 2030. Margaret Stewart, she's online, to put the recommendation on page 64. We are asked to approve the Community Learning and Development Strategy Plan 2025-2030, including Appendix B, and request that the chair of the Aberdeen Community Planning and Development Strategic Partnership submit a year one progress report on behalf of the Community Empowerment Group to a future meeting. Margaret, do you want to add anything to this?
Yes, so we are sharing our report on the one-year interim plan and taking forward the CLD plan for 2025 to 2030. The plan aims to transform lives by supporting individuals and families to overcome barriers, to build their skills and to contribute confidently to their communities. The plan has been co-produced with communities and partners, and it's been informed by the Your Place, Your Plan, Your Future consultation as well, where we asked people whether they agreed on particular aspects and priorities. The plan's structured as we're continuing to see around the determinants of health, and it aligns with our other city plans and strategies. We've taken a fair bit of work over this last year to strengthen the governance, and we've developed a community learning and development strategic partnership which now reports into the community empowerment group. So it'll have oversight of delivering the CLD plan, and it's made up of many partners within Aberdeen City Council, across Community Planning Aberdeen, including our third sector, who are responsible for leading the plan, and also how the plan flexes and adjusts, and also how we measure and have shared accountability across the citywide community learning and development partners. Our plan priorities cover adult learning, youth work, family learning, community development, our community learning and development workforce, and also how we collaborate and take that shared accountability as we demonstrate the impact that the work across the plan has. We are looking to develop thematic groups, so look across our community learning and development partners, across those priority areas, so that the staff on the ground are involved and working with the strategic partnership to make sure that we've got learner voices and community voices involved, and that again that we're making sure that we're capturing the impact that this work has had. We've created personas within this plan, and that gives an idea of some of the learners and community members that are impacted by community learning and development, and it also shows the progression that they've had as well. So hopefully that gives you a kind of flavour of the range and of influence that community learning and development work has. I'm happy to take any questions anyone has on the report or the plan.
Let's discuss. Anybody has any question or comment about the plan? Angela?
Thank you, Councillor Laird. Probably not a question for Margaret, more a question for Andy Wright, actually. I bumped into Scottish Fire and Rescue colleagues during Tall Ships. I think there were new colleagues who've moved into the city working from Aberdeenshire, and were specifically talking about work that they had done in Aberdeenshire around youth work. So it's just to make sure Margaret and Andy, that we've got the right colleagues from Scottish Fire and Rescue plugged into that youth work strand.
So in answer to that, yes, some colleagues have moved across. They were in the Shire, they're now supporting the city. It's just due to staff movement, but that then brings additional insight and knowledge, etc., because we have been doing things slightly differently in the Shire as we have in the city, but we're looking to try and have that holistic approach throughout and combine everything now. So yeah, we'll ensure the right colleagues are at the table, Angela. Don't worry.
So Angela, as you should. Go ahead, Margaret.
Sorry. Happy, Andrew, to make that connection to make sure we've got the right folk. We're about to establish the thematic groups, so timing is perfect.
Yeah, very good. Councillor Craig. Martin.
Yep. Thank you, Chair. It's a very comprehensive, detailed report. It's excellent reading. The plan is for a 5-year period. I think the legislation only requires 3 years. Are there advantages in having that slightly longer period? I'm sure that there will be opportunities in developing and strengthening resilience, work with partners, but there may be risks as well as opportunities in that slightly longer period of 5 years instead of 3.
Margaret, you want to come back on this?
Yes. So we've absolutely considered this, and in creating a 5-year plan, we're looking to align with other plans, and also so we time ourselves well with the local outcome improvement plan as well. We are aware of the need to create a CLD plan every 3 years. And we were offered an interim year last year as there was a independent review of community learning and development, so to understand some of the recommendations that have come from that. So in the next, really what we're looking at is to make sure that our plan is agile and that we're responding to priorities that are emerging from our communities and their needs as they arise. What we're working on is creating a delivery plan for each year, and we'll also update the plan as the wider plan as we need to do that. So in terms of meeting the legislation, we'll be having a refreshed plan, as throughout the 5-year period as well.
Thank you, Shantini.
So I think it's great to see, the plans come through, and it's really helpful to be able to make some of those connections across, common threads across the plans. And I just wondered whether or not it might be, given the opportunities we've got with AI and Copilot, etc. I just wondered whether or not it might be worth at some point running them through Copilot, for example, just to see if there are connections that we may not have picked up ourselves. Maybe at some point as we're finalizing 26 to 36, because there might be things that we're not seeing that, because I'm just thinking about how we bring value to, coming together and looking at each other's plans, etc.
So something that we have not seen, but AI might keep an eye on. Angela.
Yeah, I'm happy to take that. Margaret, that's already been getting done, Shantini. So the CLD plan against the Integrated Children's Service Plan, against the LOIP, against the COG risk register, against the Prevent Lessons Learned that's been kind of published, and that's kind of been a key bit within the CLD. So we are absolutely using AI extensively to make sure everything absolutely hangs together. So yeah, good point to remind us to keep doing that.
And check afterwards, of course, but AI got it right. Any other point to discuss? I might add something. As I said, Donna had a very good program in a plan, Journals of Change, and you would have seen that from page 1 to 1 there are those learner stories of those facing the greatest disadvantage, testimonies from young women, from mothers. And on page 1 to 8 we read Mustafa's story, Syrian asylum seekers telling us how he volunteered with a local bicycle repair shop, and then him and others managed to get from an anonymous donor repaired bikes he had repaired, and we managed to be given those bikes, so made it a lot more mobile for them to go to English classes, particularly. So that was one of the myths out there in the city, that people were getting bicycles for free. So that was quite refreshing to see this kind of stories, just like the stories that Donna brought. Single parent stories were very good as well. And on page 131, a Ukrainian refugee story. Svitlana tells us what she wants to improve her opportunities to provide for her children until they can return to Ukraine. Her husband is back home on the front line. So this is powerful. And I wonder how widely we should share those stories of people fleeing war and persecution, the climate we are in. You'd have seen an email coming from us on how to spot and stop misinformation online, with the guidance how to counter misinformation and false content online. Part of our collective effort is to make Aberdeen a welcoming, safe place for everyone. So I wonder how we can all encourage to talk about this, as conversations helped shift culture. In any of our partners want to share any of his practices, of his stories, of how we feel what's happening in the last few weeks, will be helpful. Angela, I know that our chief executive has had a blog. I don't know if he's out yet, to try to reassure our staff as well, which is important too. We all have staff, we all have volunteers who will be feeling about that. So I just wanted to have a little bit of feedback from the board about what we can do to counteract all those things. And I think in this report, there were some very good examples there of how it can be done daily through our reporting activities. Anybody wants to help on this will be very welcome, and share any other things will be very welcome. Anything else? So we're happy to approve the committee learning and development strategic plan. Thank you very much. Thank you very much, Margaret, for this. And again, thank you very much for the report. Now it'll be the turn of Phil, because we are going to Public Health Scotland Framework, which is page 163 to 168, and recommendation on page 165. Review and discuss the opportunities presenting by the Population Health Framework, and to agree that the relationship between the Population Health Framework and the Local Outcome Improvement Plan 2026-2036 are explored, and any necessary actions to ensure alignment are identified and taken. So we spoke a little bit about all that already in this meeting. Phil, do you want to add anything to this, please?
Perhaps if I might make a few comments to highlight elements of the framework, which might help guide some of the thinking for discussion. I haven't presented or brought a presentation along, largely because I think very often we need to think really more than necessarily understand the structure of a document, or perhaps just the kind of elements which the authors of the document want us to reflect on. Fundamentally, the Population Health Framework is something which I think is really designed to help all of us ensure that we are developing an approach to physical and mental health and well-being in a coherent and consistent way, given that there are factors which underpin each of those areas, which have to be addressed in a primary preventative fashion, whilst we are also dealing with the consequences of historical inability to address those determinants. In other words, the Population Health Framework is seeking very clearly to not only deal with the harm minimization that might be occurring or needs to occur now in the context of ongoing physical and mental challenge for the population of the city, but also put in place the type of preventative action which is needed to protect the health of future populations across the city. And I think as a framework which is very deliberately recognizing the need to do both of those simultaneously, this is something which should be extremely welcomed. The second thing I want to draw attention to is the way in which the structure underpinning the framework, the interconnected drivers, have a high similarity to the determinants of health, which we already discussed at the top of this meeting. Yes, there is a preventative focus, which we are seeking to play out within the LOIP. Social and economic factors, places and communities, enabling healthy living and equitable access have all been things which we've already discussed within the context of the LOIP and the Fairer Futures work across the city. In other words, we really should be looking not just at the opportunities that the framework presents to us for consistency, but also work which is undertaken across Scotland in the light of this framework being much more readily available for us to use and translate into the context here within Aberdeen City, and therefore perhaps be swifter in adopting the elements of what works in terms of our own actions and activities over the lifetime of the LOIP. The next thing I really want to just highlight are the two priorities. Over the short term, we are expected to address creating a preventative approach in all the work that we do in relation to population health. And obviously that's not limited to health and social care. It is a much broader set of actions and activities. And the second priority is around weight management, obesity, whichever version of the language we wish to use. It is looking at weight, both overweight and underweight, as we have been reminded. We are extremely well placed within Aberdeen in both of these areas. Though I think, as we've already discussed, some of the challenges that we're identifying in Fairer Futures do have an impact on how we develop in each of these areas. The notion of what a preventative approach is in terms of active aging really needs to be embedded on a full life course basis to be able to deliver the type of lasting change that the framework is encouraging us to work with. And then the final thing I really want to highlight is the degree to which the framework actually also could have been written to play to the city's strengths. We have already got significant work being undertaken in the context of the Health Determinants Research Collaborative, which is looking very hard at those elements of inequality and helping us alongside the CHES initiative, creating Aberdeen City as a Marmot City, in a way that helps us deal with those cross-cutting elements which are impacted on by the determinants themselves, and in which inequality is a factor which allows the determinant to be expressed in poor health and well-being. I think we are extremely well placed to actually adopt the population health framework as an underpinning approach that we can look to very extensively over the lifetime of our own ambition for the LOIP. I also think that it helps us be much more able to be helped by others and for ourselves to support others, because it provides a degree of consistency of approach across Scotland, which I think will be to our benefit rather than necessarily not. I'll pause there and take questions or queries or take whatever discussion elements that you wish to lead, Councillor. Thank you.
Thank you very much for this, Phil. Quite interesting. So yes, let's discuss. Jason first.
Thanks, Phil. I have a very simple question for you. So, the Population Health Framework and Prevention Focus System, has there been any ecosystem mapping in relation to that. I'm a simple person, so seeing systems on a map and an ecosystem on a map helps me identify where barriers or barriers to access might be. There's urgent and unscheduled care currently going through a sort of change process where they've done that mapping, and seeing their current system where we fit into it as well, especially police, is a really informative way of discovering where those barriers and issues might be. And I'm just wondering if any of the similar sort of work had been done in terms of the population health framework.
In terms of wider population health framework nationally, I have not seen any generic mapping. The approach to date has focused more on local areas, develop its own systems maps. So you'll be aware of the work we've been doing on looking at the healthy weight systems map. We've also been working on all the people systems maps, particularly within the context of frailty underpinning health and social care work. There is also work from memory that Community Justice Scotland did in looking at the community justice system map, which I suspect we could probably go and have a look for. I think your question is actually extremely helpful in terms of highlighting one particular thing we need to be dealing with. Mapping very often helps us understand organizational relationships, but actually we need to be getting beyond those into the types of collaboration and resource commitments of the type that Angela was really highlighting at the beginning. To make this work, we have to go beyond understanding our roles and responsibilities to creating environments which allow them to be delivered in an effective and an efficient way, alongside and working with the third sector and our communities.
Music is here of Angela, I'm sure. Anybody wants to add to the conversation? Councillor Gregg first.
This may be a query to extend that feedback, because I think it's really positive that we've got a whole systems approach. There's a very strong, effective strategy in place. So service delivery will have to be very carefully targeted, and I'm just wondering what are the impacts that are expected in SIMD areas? Or are there going to be some kind of metric to assess the improvements, the difference that's being made locally? Because that's obviously where we need to really intensify our efforts. So and we'll want to have strong cases for targeting resources in SIMD areas. So is that happening?
I think this is one of those areas where the benefit of working collaboratively with the Institute of Health Equity and Public Health Scotland as part of the CHES process to create Moment Cities is going to help us. The work they're already doing alongside colleagues in Aberdeen City Council and NHS Grampian in looking at metrics, particularly in areas of significant disadvantage, is helping with that guidance, as is understanding the evidence for the nature of interventions which are important. In many regards, though, the interventions are already there. So if I was to turn around and say, what's the first thing that CHES is going to want us to look at? It's going to want us to make sure that we're doing best starts in the best way that we possibly can. So I would actually argue that, are we doing it? Yes. Are we doing it sufficiently well to see short-term change? I think we can certainly see that there is movement in that direction. But given we're taking a 10-year arc over the LOIP as a whole, and we have children and families as one of our key features of the way in which we're responding to determinants within that approach overall for the LOIP, it is up to us to look at the evidence that's coming through, either from CHES or ensuring that HDRC is informing us well enough to ensure that we can target effectively. What we do, however, not need to lose sight of is that targeting needs to understand that whole populations also change over time. So what the big words that are used here is proportionate universalism. We do need to make sure that we are improving the health of the population as a whole, at the same time that we're trying to target those who are experiencing disadvantage to ensure that their health is being leveled up to the same level as the population as a whole, which we are improving at the same time.
Yeah, and I would agree, Phil. One of the things I said right at the outset is when we talk about population, what are we talking about? We've got a transient population, we've got population changes within the city, within Scotland, within the UK, within Europe, within the world. So it's not as easy as that to track. Who are we talking about? We're talking about the population. If you take 10 years, the population would have changed drastically from 10 years ago to it is now. So that modeling, that outcome, and how to judge outcome is not as easy as straightforward as if the population was staying put, which of course in 21st century it is not. Angela.
Thank you, Councillor Allard. Just to maybe come back to Councillor Gregg's point and to link into Jason's point. So I think the reflection post the conference, the propositions that you've got here today, that the level of targeting that we need to be more explicit about. So in reflecting on Marmot and being more explicit about actually the significant equity gaps that do exist. So our suggestion, so to Jason's point, we don't have comprehensive system mapping in order to identify, Jason, all of those kind of potential system barriers that are getting in the way. What we're currently thinking via the management group is that if actually what we do is take all the propositions that are on the table at the moment and actually start testing them against contribution to SIMD 1 and actually say, will they really make a difference? And if you did something quite significantly different, is there a system barrier that would get in the way for you? So just in reflecting on what's come through, I'm not sure that we've got enough around disruptive changes, system changes in the propositions that are here. I think you can cluster, there's some commonality that's coming across all of the themes, but actually given this is a 10-year and given the equity gap, we're perhaps needing some more disruption in our collective systems. But without, Jason, having all of that comprehensive system mapping, what we have been chatting this week is actually if we take all of these propositions and really test them against what contribution they would make to SIMD. If they don't, then that's not to say that they're irrelevant. They might help in that whole population. But if they can't target those targeted communities that Councillor Allard's referring to, whether that's Indigenous population or asylum, then we need to really test ourselves. So we were crunching our brains quite toughly yesterday, trying to work out how we could do that task. We will definitely use Marmot, UCL and anybody that can help us. So I just wanted to share that, Councillor, because I think the next iteration of this will need to start to look a bit different, about being more explicit about the targeted work, and it does address Jason's earlier point about resourcing. So being really clear as a partnership in those targeted areas of targeted need, can we really bring our resource together on that? And in terms of the whole population, what does our resource look like? So we're going to do a bit more work on that as a management group and bring something back to the board. So kind of helpful to have that conversation here today. But any suggestions around how we could do that would be gratefully received offline, because we were definitely tearing. But I think it has to pass the test of what Councillor Gregg said around contribution to the SIMD at that harder end, and then think about separating out what's whole population work distinct from the targeted, and really thinking about what that will mean for the presentation in our locality plans as well. So yeah, scratching our heads a bit more on that, and I think we'll bring some more back to the board.
You want to add anything to this, Phil?
No.
So are we all happy regarding and agree the recommendation? Thank you very much, Phil. And we've got two other agenda items there were for information, 4.1 Community Planning Aberdeen Board informations, and the meeting dates are also there for information. So thank you very much for the people who are online, and the people who came in person as well. Sorry, people online, you didn't get the hard copy of the report, but I'm sure you can ask Donna and you can have one of them. Thank you very much for your contribution today. And I'll see you at the next board meeting. Thank you again.
Thank you. Take
Thank
care.
you very much, colleagues.